Hi, I'm Miles, and today I'm going to be telling you guys about chronic fatigue syndrome. What is chronic fatigue syndrome? Well, systemic exertion intolerance disease, or myalgic encephalomyelitis, aka CFS, is described as a complex disorder, and it cannot be explained by any underlying medical issue. Extreme physical and mental exhaustion beyond normal fatigue. The cause of it is unknown, and rest does not improve this disorder. Right here we have a graphic showcasing published studies of different diseases such as RA, MS, lupus, and right here ME/chronic fatigue syndrome. And as you can tell, the research for CFS has been pretty stagnant over the last 25 years and beyond, so not too many people are educated on this disorder. To get started, we have the symptoms, obviously exhaustion, weakness, fatigue, mental stress that depreciates mental acuity. You can experience brain fog, headaches, and migraines, and you experience little to no sleep. And if you do sleep, it is pretty unrefreshing. To continue, you experience a sore throat, enlarged lymph nodes in your neck or your armpits, exaggerated muscle pain or joint pain, aka myalgia. And then you could have a normal exhaustion lasting more than 24 to 48 hours after physical exercise, and then elongated recovery time from physical and mental exercise. Some common diseases, not common, but other diseases and disorders affiliated with CFS would be fibromyalgia, IBS, anything head-related, like post-concussion syndrome, tension headache, and then in women, chronic pelvic pain is present, and in men, chronic prostatitis, so pain in the prostate. We should start to understand CFS. So to get into it, it's not a result of any specific medical condition or conditions, which we went over earlier. There's no single test to determine CFS. However, a variety of medical tests can be used to rule out health problems, which can in turn allude to the diagnosis of the disorder. It should be noted that people with CFS appear to be hypertensive and have trouble with basic activities of daily living. And lastly, the disorder is believed to be triggered, not just caused, but triggered by a combination of factors, including viral infections, immune system problems, hormonal imbalances. And then first, viral infections. So research suggests that many people develop CFS after having a viral infection. Three common ones are mouse leukemia virus, and then human herpes virus, the Epstein-Barr virus, HHV4. Human herpes virus number 4 is a common herpes virus that is spread through saliva contact. This can result in mono or infectious mononucleosis. This can give you fatigue, extreme fatigue. The antibodies are present in you, so it goes away after you're cured or you're not sick from the disease anymore. However, human herpes virus 6, this infects nearly everybody. I think 99.9% of all people are born with it or get it within a couple years of being born. This is latent but may be reactivated. So you're probably born with the antibodies of the disorder, but this can be triggered. This can lead to thyroid issues, and that could hurt people with MS and CFS especially. Some immune system problems here. People who suffer from CFS reportedly have impaired or poorly working immune systems. We'll get into that later. Having a poor immune system obviously can help derive frequent illness or catalyze frequent illness. And this can be a correlation to a lack of sleep or fatigue that many people are experiencing who have CFS. Hormonal imbalances. This is something very important. People who have suffered from CFS can experience abnormal blood levels of hormones produced in the hypothalamus, pituitary glands, or the adrenal glands. Hormone imbalance is a major concept of CFS. As we continue, we'll focus on the endocrine system and the hormone cortisol. Cortisol, you can find the chemical structure in the bottom right corner of your screen. The prime organs of the endocrine system are the adrenal glands, and you have one above each kidney. They're responsible for cortisol production. This helps regulate blood glucose levels and makes glucose available for brain function. Cortisol is very important for breaking down fat for energy and most notably helps manage physical and emotional stress, two things that can help trigger or major symptoms of CFS. As we continue, there's a direct linear correlation between fatigue and stress. Somebody who's positively stressed would probably be experiencing positive fatigue as well. So if I'm very tired, I'd be very stressed. If I'm very stressed, I'm very tired. The adrenal gland responses to stress works directly with the nervous system in a fight or flight response. This can lead to problems such as an increased heart rate, increased heartbeat, respiration as well. This overall can lead to higher blood pressure and a risk for stress-induced hypertension, something you don't want to experience. As we continue with hormonal imbalances, Dr. Mark Demetrak, a leading researcher on improper hormone function in CFS patients, found significant reduction in blood and urine levels of cortisol in his patients, and he started to theorize that CFS is a stress-related disorder. Lower cortisol levels reduce the ability to cope with stress, and the symptoms of CFS are catalyzed by physical and emotional stress, obviously. Doctors Lucinda Scott and Timothy Dinan have also researched CFS, and they have researched the neuroendocrine dysfunction, the underperforming actions between the nervous system and endocrine hormone function. This is directly correlated to hypoadrenalism, which is the lack of effort or lack of work being done by the adrenal gland. This can encourage chronic immunological activation. This leads to the belief that the interaction between the neuroendocrine and immune systems is disturbed in people who suffer from chronic fatigue syndrome. We continue, we have risk factors here, age, sex, and stress. CFS is most common amongst people in their 40s and 50s going through a midlife crisis. So it kind of depends on the idea that you're more likely to develop CFS through nurture versus nature. Here we do know that it can appear to run in families. There have been studies suggesting genes that may be inherited that would increase the risk of CFS. However, it is generally considered or known that the tendency for one or more family member to contract or develop this disorder is because of a shared environment of their lifestyles. So like we said, nature is ruled out and nurture is something more important. So having a high stress lifestyle and not doing much to help rest your body over time can allude to the disease. Lastly, we wanted to add sex, so your gender. Women are diagnosed with CFS more often than men, but it should be noted as probably because women report their symptoms to a doctor more often than men do. For exercising with CFS, there's no difference in the physiological response involved in either aerobic resistance or strength training. Resistance and strength training go hand in hand. I meant to add flexibility right there. This is all dependent on the individual's fitness level, their own perception of effort, and how often they exercise. And then recovery time may be elongated in extremely deconditioned or fatigued individuals. So as we mentioned earlier, it may take you longer than 24 to 48 hours for your muscles to heal. Obviously, this is not something good, and this would definitely disrupt your workout regimen. It should be noted that this is not just present in the people that have CFS. It's all dependent on, if you do have CFS, it's all dependent on your individual fitness level. So if I was a very fit person, for example, I would probably recover, even if I had CFS, at a greater rate than somebody who has the same disorder but who wasn't as fit. It should be added that the FIT principles for healthy adults do not have to be altered too much, like we said, based on CFS being present. It should only be altered depending on the individual's response to exercise. Some special considerations we have here: we want to avoid pain. Like we said, pain can be exaggerated due to fatigue, and then ensure you're giving proper rest times in between working out. General fit guidelines: you want to be working out 3 to 5 days per week at a low to moderate intensity, and you can increase this gradually with progression. It's encouraged to use an RPE scale, and the rate of perceived exhaustion level should peak around 10 to 12. However, these could be exaggerated due to fatigue. That should be noted, especially if you're training somebody who has RPE or training somebody with CFS, that their RPE may be a little bit off because they think they're doing more work than they really are, and that is definitely a symptom of being overly fatigued. Thirdly, the time of exercise, so how long you're working out. It should be noted that individuals respond better with shorter workouts because we higher engagement. So if I had CFS and I wanted to work out for 15 minutes, I'd be more engaged than if I was doing a 30-minute exercise. However, I did want to add aerobic exercise should be at least 30 minutes per session because you want to strive for longer mental engagement and physical engagement. You want to work towards that goal. And the type. All types of trainings are advised. You want to make sure you're doing low-impact exercises, and these may be preferred to lower fatigue people, and you don't want to increase the fatigue anymore with exercise. Treatment. There is no singular treatment for CFS itself. However, the disease can be treated in terms that the symptoms can be treated. So right here we have a table demonstrating 5 major symptoms of CFS. Sleeping problems, pain, depression, stress, anxiety, dizziness or lightheadedness, and memory problems. So a doctor should be consulted whether you are experiencing all these symptoms or just one of them. Some symptoms like sleep problems can be fixed with over-the-counter medication. You should be prescribed sleep medication by the doctor if the problems persist past that. Pain can also be fixed with over-the-counter medication, but you should still consider a doctor. And then counseling for dealing with the pain. Depression, stress, anxiety. You may be prescribed medication, but you want to practice in your free time your deep breathing, meditations, and movement therapies such as yoga, or walking, or going to spin class or step class, or doing dancing. And then for dizziness or lightheadedness, you want to increase your daily fluid. Many people with CFS do tend to experience symptoms of being dehydrated when extremely fatigued. So if you increase your salt intake and increase your fluid intake, you'll be able to retain the salts at a greater rate. And then increase vitamin B12 and vitamin C. Vitamin B12 for energy, and vitamin C you want to increase because you'd have a lower immune system and you're more susceptible to colds and developing other illnesses while you have CFS. Here we have our case study. We're following Mike. Mike is a 31-year-old. He's married, and he runs his family-owned restaurant. He has one daughter, and his wife is pregnant with their second child. Mike is obviously very stressed because he's the lone income for his family. To deal with the stress, he likes to smoke cigarettes, and his wife doesn't know about this. He has packed on a few pounds. He has somewhat high blood pressure, 129/80. It's pre-hypertensive, and his BMI is 29.0. He's 6'1", and he'd be weighing about 220 pounds. So he's right on the edge of being overweight right before obesity hits. He wants to try working out again, but he's been on a vegan diet as a New Year's resolution, which is positive. He complains about his headaches, complains about being tired, and he feels he does not sleep well and is constantly stressed. He does not take any medications. For me, if Mike were to come to me, I would tell him to, 1, consult a doctor. He should work less and avoid stress. He should definitely quit smoking because of all the other potential risks he's putting on his body. And then he should start exercising. Something he could start doing is aerobic training 3 times per week. He can try cardio for 15 to 30 minutes. He should be walking his daughter, walking the dogs, and if he joins the gym with his wife, he can be doing cardio machines up to actually running. And then for him, flexibility training. If he's always tired and he's having problems with his muscles in recovery, you should be doing flexibility training 3 to 5 times per week. This would lower your stress levels, helps with muscle recovery, and these sessions should last them 15 to 20 minutes each time. And lastly, for resistance training, you can do this about 3 times per week. You should start light, make progressions, and become more intense as time goes on. And he should be doing these sessions for about 30 times a day, or 30 minutes a day, I'm sorry. Just to close out here, we have the references listed, and you can work out with CFS. It is advised, but you should consult a doctor. And there's not just one cure, but you could diminish those symptoms. Thank you guys. That's all I